Hi, this is Karen Hogan, one of your faculty for the HIT course at Denver School of Nursing, and I'm going to be doing a review on the quiz for week 3. Now, a couple disclaimers. This is not a professional recording. You may hear my cat meow or the sirens go by outside, but I will try my best to help you work through some of these answers. Let's take that, and by the way, there are 20 questions in this quiz review. You only get 10, so there will be questions on here that you will not have seen before. I am employed and work for Kaplan and do the NCLEX review course, and I'm going to be using some of the techniques, for example, eliminating answers and trying to figure out what the question is that may help you with some of these quizzes. So let's go on and look at the first question. A computerized data management system that supports several activities: order entry, result retrieval, documentation, and decision support. Now, when I look at that, I'm thinking, what are these things? These are all clinical. Order entry, getting results, documenting. I may not know what decision support is, but it certainly sounds like it might be part of the clinical decision making. So let's look at the answers. A clinical information system. Well, that sounds like a correct answer, so let's keep it. Administrative information system. Is there anything in there that is administrative? I can't see anything, so let's eliminate that one. A hospital information system, well, that's a pretty broad term that really doesn't tell me very much. And then a database. Well, all of this is a database. The most correct answer, and the correct one, is your clinical information system. That is on page 14, and it's on your presentation in slide number 3. Let's go on to the second question. The goal of using clinical information systems. So let me think about what the goal may be. It certainly would be to increase patient safety and increase efficiency. We've already talked about some of that in the threaded discussions. It would be to eliminate some of the errors that may occur, to improve communication. So let's take a look and see if any of these answers relate to what I thought a clinical information system is. Enhance efficiency of care. Well, that certainly is an appropriate answer for a clinical system. Increase nursing staffing levels. Well, any hospital or clinic or private practice is not going to want to increase your staffing levels. All right. Unless there's a real need, and that's not the goal of using your information for your clinical information systems. Improve technology use by nurses. Well, that certainly probably will occur when you use a clinical information system, so let's keep that in and move on. Reduce support staff on nursing units. That certainly also is the same with increasing nursing staffing levels. A clinical system is not going to do that. More administrative and scheduling systems will do that. So now we have 2 answers: improve technology use and enhance efficiency of care. And if you look at those answers, the best answer and the correct one is your enhance efficiency of care. That is on page 114, and it's on your presentation slide number 3. All right, a well-chosen nursing information system. Now, if I stop and think about what would that help me to do as a nurse? Well, it would help me to document. It would help me to improve my efficiency. It would help to decrease medication errors, as we've talked about in our discussions. So let's see if there's anything in here that will do that. Reduce length of stay. Well, what has that got to do with a nursing information system? Really nothing. So we're going to eliminate that. Benefit nursing. Well, all the things that we said a nursing information system will do ultimately benefits nursing. Increase overtime costs. There is really no hospital or, as I said, system that really wants to increase your overtime costs. And enhance scheduling of staff. That one is not done by the nursing information system. That will be done by a scheduling or administrative system. So your correct answer is benefit nursing. And that is on page 115 in slide number 4. The nurse is using a nursing information system that requires documentation by exception. So let me stop for a second. What would I think that means to me? Documentation by exception. Well, what that points out to me is that means I probably wouldn't have to document as much. That I would only have to document things that perhaps are abnormal. The nurse understands that this method will reduce time and documentation by requiring that the nurse free text all information. Well, you know by using your smartphones that you don't free text every single word, and that certainly doesn't save you time. Document only information that can be displayed on a flow sheet. Well, that might be an answer. We do use a lot of flow sheets in healthcare, so let's keep that one and move on. Use a progress note. Again, this is going to be free texting, and that certainly is not going to reduce time. Document on exceptions to normal conditions or ranges. Well, there's the same word in the answer that's in the actual question. All right, and document on exceptions to normal. What that means to me is that if somebody has a normal heart rate, I don't have to document except to say that that's within a normal range. If they have an abnormal, which is an exception, they have a murmur, I would need to document that and the location of that murmur. All right, number 5, the nurse enters an order in the clinical system for several meds, and an alert is posted that the provider has entered an order that the patient remain NPO. So, alerts, what do they do for me? All right, as a nurse. All right, well, what they do is certainly improve communication with the provider. They certainly increase my efficiency in time management because I don't have to go to the provider and ask them if they want to have the patient be NPO. So let's take a look at the answers. Improve communication. Well, that certainly is an answer I thought might be beneficial. All right, as it does, the provider has told me that the patient needs to remain NPO. So let's keep that answer. Increase employee satisfaction. Well, alerts are not really going to do that. Actually, sometimes alerts cause alert fatigue, and they sometimes decrease employee satisfaction with your electronic systems. So we're going to eliminate that. Improve mandatory reporting. Well, alerts aren't going to really do anything in terms of mandatory reporting. And then enhance compliance with agency regulations. Well, that seems like a pretty big term for me, and I'm not quite sure what that might have to do with just having an alert that the provider wants that patient to remain NPO. So the correct answer is improve communication. And that is on page 119, slide number 5. The nurse is reviewing information about a monitoring system suggested for purchase by the hospital for use in the cardiology unit. So if I'm going to be helping to vet a monitoring system, what are the things that I'm going to want to consider? Well, I'm certainly going to want to make sure that the nurses can easily understand the machines, that if they're going to be using them in cardiology, I'm going to want various alarms, all right, that the nurses can identify, and that one that would coordinate with the electronic and feed the information back into the system. So let's take a look at the answers and see if anything relates to what I've thought about. Ability to monitor the patient only when stationary. Well, in a cardiology unit, that's not going to happen. Variable alarms for different abnormalities. Well, we use a variety of different alarms on our phones to notify us if one person is calling or another person is calling. So that sounds like a pretty good idea. Ability to silence the alarms to avoid disturbing others. If you're implementing a monitoring system for use in the cardiology, you want to be able to hear the alarms. Security features, so I'm going to eliminate that one. Security features to prevent storage of data and downloading. Well, I'm not quite sure that that would actually be really good in terms of a cardiology unit, you certainly do want security features, but that's not going to be up to me as a nurse who's reviewing information. That's more pertinent to our IT department. So the best answer here is your variable alarms for different abnormalities, and you will see that. That is on page 119 and presentation slide number 5. Oops, I think I said that wrong. Page 118, I'm sorry. I'm getting ahead of myself. All right, a patient is in the emergency department in a local hospital. After having diagnostic studies, the patient receives a call from his primary care physician or nurse practitioner to report the results of these tests. This rapid result is possible because the radiology department used a scheduling system to ensure that the staff and equipment was available for the patient's test. Well, that's actually true, and they do use a scheduling system, but that doesn't really have anything to do with the fact that the patient has now received a call from his primary care provider. So let's eliminate that. The result was likely emailed to the physician by the department staff. Well, that certainly can occur too. So let's keep that one and move on. The hospital is using picture archiving and communication systems. Well, we know from the reading that this definitely, radiology departments and diagnostic departments definitely do this. So let's keep that one. And the physician was in the radiology department to read the films. Well, first of all, the physician's not going to be in the department. And second of all, they don't really read the films. So the best answer of these two of these, the result being emailed or the hospital is using picture archiving, that one is the correct answer. And that is on page 122, slide number 5. All right, question number 8. When using a registration system for patient management, accurate patient identification is ensured by using date of birth. We don't use that as the only identifier. Social security number, the same thing. A unique identification, a code that's used across all departments is the correct answer. And scanning the patient's driver's license and insurance card is certainly not the way that a registration system works. And that is on page 128 in the presentation, slide number 15. An example of the use of contract software, management software would include. Now, when I read that, it's contract management. So they're negotiating probably with outside vendors. And if I'm negotiating with outside vendors, I'm going to want to make sure they're getting the orders in, that the orders are correct, that payment is being received by them, etc. So let's look at the answers. Determining what a patient's insurance will cover for a particular device, that's not contract management software. Negotiating employment agreements with staff, well, again, that's not contract management. Ensuring that equipment suppliers meet their contractual agreements, that sounds like a good answer. And noting what other agents are paying nurses and physicians, that also is not a purpose of contract management software. And that is on page 129 in presentation in slide number 15. Question number 9. An example, wrong one. I told you this wasn't professional. Risk management software. All right, this one was a tough one for people. Let's say I totally forgot what risk management software. If you go back to the index in your book, e-text, you will quickly find it on page 129. So risk management software is a big picture system that helps an organization to identify potential risk and develop strategies. All right. Some of their features include dashboard views, regular emailing of reports, to manage policy claims, litigation. It's big picture. It's not it's not designed to identify one patient. All right, so let's look at the answer. A nurse manager needs to discuss an increase in patient falls and needs data to include in this discussion. Well, you can see that there's an increase in patient falls. So they've identified that as a risk factor. It's not just one patient, so let's keep that. A nurse manager must discuss the risk posed by falling to properly identify a patient prior to administering medication with a nurse. Well, that's quite a handful, and this is certainly important to do, but your risk management software is not going to be used by a manager to discuss treatment with one particular nurse. A nurse practitioner is in need of information about proper dosing schedule. Again, there's other tools that are available for that. Physicians for looking for risk-benefit information to share with the patient. Provider can certainly use the patient education that's built into all electronic systems. This is on page 129 in presentation slide number 15. This one was a tough one for people, but the thing you have to think about it is its big picture. All right, smart technology can improve patient safety and decrease costs. Well, if I think about smart technology, I think about my phone. That has smart technology on it. It allows me to do things easier, like deposit a check from home at 2 o'clock in the morning rather than going to the bank. So let's take a look at some of it. Remove all sources of provider error. Nothing is ever going to do that. You know that from our discussions. Basing care on system-generated orders and actions. Well, I'm not entirely sure what that even means and what that has to do with smart technology. Reducing extra steps required for clinicians to communicate. Well, just like the banking smart technology on my phone, I don't have to go to the bank. So let's keep that answer. Limit the number of devices and systems in use to care for the patient. Actually, with smart technology, you often will find that there's an increase sometimes in devices being used for the patient. This is on page 131 to 133, and it's on presentation slide number 22. Patient safety can be enhanced by the use of smart technology because it allows for care tasks to be prioritized based on patient safety needs. Well, that certainly sounds like smart technology would allow me to do that. Safety data to be sent to the patient's insurance provider. That doesn't have to relate to patient safety. Look at the question. Increase patient control over their own care. That certainly can occur. Patients can end up ordering their meals, getting hold of their nurse through some of the use of smart technology. But again, you're talking about patient safety. Let's leave that in and get back to it. Hospital cost savings. Again, that doesn't have to do with smart technology. If I look at my two answers, care tasks to be prioritized or increase patient control, the best answer is the first one. Care tasks to be priority based on patient safety needs. Again, that's on page 131 to 132, and it's on presentation slide number 14. An example of smart technology uses a physician noting the results of a physical exam on a notepad. Well, that doesn't sound very smart. Well, it is smart, but it's not smart technology. The nurse asking a patient and family to view patient education video. Not smart technology. An alarm notifying that IV infusion bag. That is not smart technology. That actually occurs because you will hear those variable alarms that go off. Vital sign data that's transmitted directly from the bedside. You take the vitals and it goes directly into the it should be EHR, electronic health record. Again, that's on page 132, presentation slide number 23. When considering adoption of smart technology, it's crucial that the devices be mobile and durable. Well, that sounds like it is a good answer, so let's keep it. Inconspicuous in the room. That's not the best answer for this. It's not going to be the key determinant when considering adoption of technology. Simple and intuitive. Well, that sounds like it might be really important, because if you're going to implement this for both clinical staff and patients, it has to be simple. And reasonable cost, again, that certainly may be a driving factor. There are a number of these that could potentially be the correct answer. But when you look at these questions, what is the most important one there? That it's simple and intuitive to use. On page 132 to 133. The human factors of system and device design include cost, efficiency, and reliability. This is straight out of the book on page 173. Not there, it's listed straight on the book. Your ergonomics, usability, and human-computer interaction. And that's on page 173, as already mentioned. To design a nursing system that will enhance usability by the nurse. So what does that mean to me? That means that the nurse is really going to use it. Requires that the design be developed with a patient in mind. Well, that's not going to enhance my usability as an RN. Knowledge of other systems from other industries be used. Well, that may lend to a nursing system. So let's keep it in and we'll move on. The technology use of the nurse be assessed. Though we certainly want to, when we're implementing systems, to know what the technology knowledge of staff are. This is not going to be a key driver in terms of usability. The focus on the nurse user should be central. That actually sounds like it's something that will help the nurses to enhance usability. So if I look at the two answers, knowledge of other systems and the focus on the nurse should be central, the most important answer here is the fourth one. Again, this is on, I can't find the page, I must have selected off this one. This one, a nurse avoids using barcode administration, has developed an unsafe system to work around. Well, when I took this question, and I do take them without the answers, I chose usability. So we had a number of, between Dr. Post and myself, we had a number of students who challenged us on this, which I really appreciated. And we've decided that both ergonomics and usability are correct on this. Because if that nurse has developed an unsafe system, you've got a couple of things here. She can't read the display. That definitely can be ergonomics, but that's also part of the usability. So both answers here are correct. And that's on page 173. To test the usability of a new feature of a nursing system early in the development process, the information specialist should. This is on page 183. The types of usability tests are determining user needs and requirements, the exploratory tests, and an assessment test. All right, if you look under these, and it certainly, this is why we have an open book, all right, is for you to be able to go back to that. But an exploratory test is conducted early during the development or redesign phase, after very basic designs have been created. So this is the answer. Again, it's on page 183, and a quick search of the index should be able to help you find questions if you do not know the answer. When conducting task analysis to determine usability of a design, of a system in the design phase. The observer produces a diagram depicting the cognitive processes performed by nurses. This is what is called as a workflow analysis. It's usually done using some type of drawing program, like, for example, Visio, which is a Microsoft product. So let's look at the answers here. An ask scenario, if you were to go back into your book and look at this, you would find there isn't anything such as an ask scenario. A workflow diagram, an affinity diagram, and again, a task sequencing. So the correct answer is workflow. Again, this might be a question that you might have to go back into your text to be able to determine the correct answer of this. And again, this is on page 183 to 184. And the last one, oh, not quite, yes. The informatics nurse special employees, think about protocol with nurses using a new system application. This is an effective method to determine usability because the correct answer is it allows observation of the user when performing specific tasks. Again, this is on page 183 to 185. I hope this has been helpful. If you have any questions, feel free to get hold of Dr. Michelle Post or myself. Again, the reason why we have ended up giving you so much time with these 10 question quizzes is because you can go back into your e-text. We realize there's a lot of reading here, and we want you to be able to not have to memorize this, but to be able to understand it.